Welcome to Dr. CFO podcast. Today, my guest is Brandi Evans from Pocatello, Idaho. Brandi, thank you so much for joining us today.
Thanks for having me on. Great to meet you, Carl.
Great to meet you as well. For how long you live in Pocatello?
Since 2002.
You like it here?
I had a 1.5-year hiatus in 14 back in Boise. But yeah, I love it here. I love that we have the Pocatello airport. It's super convenient for my
Stuff.
It's 10 minutes from my house. It takes me 14 minutes to leave my house, get to the airport, park, get inside, get through TSA, and be walking on the plane. So,
Do you travel a lot?
Yeah, quite a bit.
I used to travel a lot too, so I don't envy you.
You know, a lot of people think it's super glamorous, and it is not.
Not at all.
It is not. It's really fun. I've met a lot of great people. I really enjoy traveling. It's one of my favorite things to do. But there is a point of diminishing returns.
I get anxious every time I see a plane. If I can't drive, I almost don't want to go. Before I did this many years ago, from 1998 to 2002, I traveled for 4 years, like almost every week on a plane, traveling all over the country.
Crappy coffee, terrible.
1 year I put on 350,000 domestic miles.
Too much.
Yeah, so I was red eyes. It was hard on everybody. Tell us your background, what you do, what makes your company special.
I've been a dental hygienist since 2007. I've had so much fun learning, growing, and in the learning and growth has come primarily from the places that didn't go well. So you've been practicing for a long time. You know that it's fun to be successful. And the times when things didn't go very well is actually where you gained the most and then are able to serve the community around you the best. So I have a company called Stellar Outcomes that does continuing education and coaching for individual dental practices. So I teach dentists and their teams how to have great days while providing exquisite individualized care.
Okay. And that started in what year again?
I opened Stellar Outcomes in 2014, so I just celebrated my 10th anniversary as a coach and a continuing education provider. Yeah, I really love what I do. I feel so blessed to do this work. So I was able to design and implement a dental hygiene program at a brand new office. What I saw over the first several years of my career was that the patients that were healthy got great care, and the patients that had super pronounced disease got great care. But in between, my patients that had gingivitis and early periodontitis, I did my best. I did my best to get all the plaque and calculus off. I gave them my best education. I talked until I was blue in the face. And you hear me say, I did this. But I was also unsuccessful. That big middle part of my patient population got more disease under my watch. Not fun. So what I learned was the dental hygiene care, my practice was all about me. The moment I realized I had to flip that upside down and make it all about my patient, even though I was taking such good care of them and loving them, I wasn't having them guide their own future. And as much as I can do a great job with you sitting with me in the chair, I don't go home with you, and I'm not going home with your disease. So while we're sitting here visiting, if I cannot equip you with the tools that you need to, number one, make your own decision about where you're at, and two, what you would need to do moving forward to improve that disease that's operating in your mouth, which worldwide, 50% of adults have mild, moderate, or advanced gum disease, right?
Okay.
You think, oh, well, there's lots of third world countries involved in that. No, that statistic's the same in America. We have so much periodontitis, so much inflammation and other chronic diseases that are just killing us dead, if you will. So how do you bridge that gap? How is this middle part of my population, that whole big everyone in between, going to get the care they need? I figured out, and this is what I love sharing, if I can guide the patient through assessment in a way they understand what's going on, I no longer have to tell them they have gum disease. Okay. They tell me. I explain what we're doing, what we're looking at, why, guide them on the path of this is health, this is disease. We get done with assessment, and the patient looks at me and says, Brandi, what are we going to do? Now, this is different because typically in dental offices, and you'll see this at continuing education conferences, they teach how to do great case presentation, how to get your patient to buy more, do more, be committed more, provider-centric. Whereas if I say, here's the situation, and you say, oh my goodness, I have gum disease, guess what you're going to do when you go home?
Think about it. Try to take care of it, I would assume, right?
And now you're not in trouble because you didn't brush and floss well. Now you're empowered to solve your problem.
I like that. So I'm guilty. I'm the person that needs you to help me do a better job, because I have to admit, before I go to the dentist, I'm like a double teeth brusher, a double flosser, trying to hope that nobody will see my dental sins. But I know you're going to. But, that's what I hope. It's worse for me because my son-in-law is my dentist. He's a good sport about not making me feel bad. I've noticed as I get older, I thought my teeth were like, I'd never have a problem. They've kind of crossed that path of where, wow, I'm having a lot of problems with my teeth, and so I'm trying to take better care of them. And yeah, it's important. And unfortunately, to your point, I wish I would have thought about that 10 years ago, a little bit more serious.
Well, the conversations have been changing tremendously. In the 10 years that I have had my business, I have noticed that originally when I would talk to even other professionals, even other hygienists and dentists and healthcare providers, there was still this complete disconnect between the mouth and the body. Now, not only with other healthcare providers, but with my patients, people are much more open to the idea that our mouth is connected to our body, and the inflammation is not a great thing unless we stub our toe and need that spot to heal quickly, which is what inflammation is for. Acutely good for us. But the problem is we are living inflammation lifestyle. So the information that we take in is inflammatory. The food that we take in is inflammatory. The way that we let the plaque build in our teeth and consequently also in our heart valves is inflammatory. So that chronic low-grade inflammation is causing disease for which, every aspect of medical care is trying to combat. But until we can get our patients to take the ownership and responsibility and interest in their own health, we're going to be sticking Band-Aids on bullet holes until the cows come home.
Yeah, I agree with you on that. In some of our consulting with the different doctors, like podiatrists, dermatologists, dentists, I kind of view healthcare kind of in three groups. So we've had preventive care, which in the 1800s, maybe early 1900s, preventive care, was our main thing, right? Then it changed to kind of like sick care.
Oh.
And then I think in the future, it's going to be like augmentations, like maybe you could to grow teeth or who knows what. But, your eyes can do better than you're born with. You can hear better than you're born with. They're looking at those types of things. But the preventive care has been lost. It has been lost. So that's really interesting. There's a lady in town. I've been thinking about her a lot lately. I don't know how old she is, maybe 90 or something. And she's from Germany and was there during the war and talked about how they could only use like natural cures to live. And if somebody got hurt, they needed a doctor, they were just going to die. She's a really interesting lady.
Oh, yeah. Definitely document her.
What?
Whenever you can get her on camera, it would be very, very valuable.
We're going to think about her every now and then because where do you hear that from,
Yeah. That's powerful.
Yeah,
and we need to know that in so many forms. Absolutely.
All right. Well, I'm going to skip to my next question here and you kind of hit on this a little bit, but I want you to touch about it a little bit more. Like, what's your number one diagnosis to dentists? And maybe we could add to that. What's your number one problem? Maybe it's the same thing. Maybe it's different, but speak to that. I'm the dentist. What are you going to tell me I can do to improve my practice? So
the first thing that I'm going to say is get your entire team together and decide what your values are and what your goal in care is. Because if your goal is cosmetic dentistry and half your team doesn't know that, you can't operate that way. So the starting point for me always is get the whole team together, figure out what your values are. Why did you become a dentist, hygienist, or assistant in the first place? Why are you at the front desk as an administrative rock star? Then once you have that, figure out what you can do to support one another as you guide your patient on the road to what you're hoping for. In my case, I am often trying to get the entire practice to work together to get the patients to diagnose their own disease. Decay is as rampant as periodontal disease, and so our patients have decay, they have periodontal disease. And what we want to do is take out all of the words that make us separate from our patients. So we went to dental school and dental hygiene school and have learned this amazing vocabulary. But when you start sharing the vocabulary, it automatically puts you other than the patient. So my trick is to explain everything as if speaking with a fourth grader. Fourth grader is fabulous because they're old enough that you're not going to talk down and patronize them, but they're not going to have that crazy dental vocabulary. If you can explain something simply, people get it. For example, periodontology. It's a textbook this big.
Yeah.
1 to 3 millimeters is normal, and healthy gums don't hurt or bleed while I measure. Whole book, one sentence.
Okay.
So if I tell you that, and then I lay you back and I'm measuring your gums, and I'm looking to where the gum and the tooth and the bone connects, and I say 4, 5, 6, 7, what do you think?
Since I've actually asked this question, I think I know that the higher the number, the worse, right?
Right.
Yeah. And so the last time I did this, they're like giving these numbers. They're kind of a little bit more honest with me.
Yeah.
And so I go, what does this mean? They're like, well, this is healthy number. So now I immediately knew, oh, I'm out of the healthy range. It got me thinking about what the hell's going on with my teeth. Basically is really what I was honestly saying.
Right. Right. What's going on? What's going
Yeah.
on in my mouth? Not Brandi's giving me a lecture. Brandi's not mad at me. What you said back to me is exactly what I'm going for. You said you wanted to know about you. And that's how we get the dentist and the hygienist and the front office and assistant team all working towards the patient's health. What's fun about this, Carl, is when you can get your patient to diagnose their own disease. You got to do high quality assessment. So the steps to that are medical history, blood pressure, oral cancer screening, the x-rays that they need for that day, and then a full mouth perio chart every time. If you can get them at the end of that to say, oh my goodness, what are we going to do about that decay or that gum disease? Then you're empowered. You're also committed to the care that I'm going to provide.
That's true.
And you're going to go home and do something different. So that moment where we have that aha is very, very inspirational, and it's powerful and it's cool. Like get a cake or whatever, but it's fleeting. What the true transformation is when you go home and you take your health upon yourself and make the modifications that you need to serve you, you come back in. And now I see as the dentist or the hygienist that I've actually made a lasting difference in your life. Now my career satisfaction is through the roof. Not to mention the fact that you did have gum disease, and so I treated the gum disease, which it costs more because it takes more time, skill, and expertise to take care of than a preventive cleaning. When you start calling a spade, your production naturally skyrockets. And I believe that the reason to do this never is about the money. And I know that you work with numbers, so that's a juxtaposition, right?
Not really, because I have a podiatrist I work with off and on. Okay. And he works with a lot of Medicare patients. Sometimes that patient group doesn't care about their treatment or outcomes.
Right.
Okay, so what you're saying, I think we pushed into other specialties besides dental. But anyways, his numbers weren't very good either because he had mostly Medicare. And what I'm saying is, maybe a little touchy, but okay, but it's kind of hitting on what you're saying. So as I was going through his numbers, one, he wasn't really making a lot of money because he was only dealing with this patient population. But there was something else. I realized he was a little depressed. Maybe he didn't feel like a great doctor because he wasn't making much money. But I realized it was like these people don't care about their treatment.
Yep.
And if they don't care about their treatment, then it gets in your psychology and you think you're a terrible doctor.
Yes.
I was telling him, look, your psyche can only handle so much of this. So if you don't feel like you're a good doctor or hygienist, all the money isn't going to fix that, right? So you need to have like an attaboy or a pat on the back or something. You need to have those warm fuzzies of feeling like you're good at your job in addition to the money. Right? That's what you're saying.
Well, and rewind all the way back to why did you go into the profession in the first place? And for most healthcare providers, it's because they wanted to help. In the dental team, a lot of times we joke like we wanted to help people. So then you think nursing, but I would pick the mouth over the bum. So, like you kind of get to pick what the fun part to you is. And so when that patient comes back and is better, and then they come back in 3 more months and they're better still. And then you have this whole group of patients. Guess what? Everybody has that I'm doing a good job feeling. And the appreciation is so much more rewarding than the money. Now, having said that, the money's a good measurement to are we addressing the disease that's in the population of our patients? Because that statistic I was sharing with you earlier, half the adult population, it's 47.2% until they get to age 65. And then it jumps to 70.1%. So we're talking anywhere between half and 3/4 of the population have gum disease. And then 90+% has the starting of gum disease, which means that the infection isn't down into the bone yet. It's in the soft tissue of your gums. So once we get those patients coming back in for care that they need, then the production and the financial wellness of the practice skyrockets. Now, what I believe, and this is just personal philosophy, is that we are meant to do a good job earning that financial piece so that we can take care of ourselves, our teammates, and our community at large. Because the healthier the practice is, the more the practice can give back to their patients and their community. For example, if someone comes in and I know they really are committed to their health and there's not a single extra dime, period. What's so great about a healthy practice is I can look at a human being straight in the eyes and say, I am so glad you're here. I would love to take care of you today. This one's on me. And a healthy practice, there's no problem for the hygienist to clock out and the dentist to provide the disposables and if they need anesthetic and the couple of hours of time. To me, that is when we're really actualizing what we're meant to do on this planet for our brothers and sisters, having the human experience with us. Like sometimes you're down on your luck and there is not an extra dime.
Right.
But if you have been inspiring your patients that have disease to take care of the disease, then your practice is very, very healthy. And that's just it's an indicator. It's an energy indicator to whether or not you are caring well for the patients that are in your practice. And then you take it that step further and, you do give kids a smile day, you name it. It's fun. It's fun to donate care.
So I got this question in my mind. How would you transfer, like you can get maybe fourth graders and above responsible. How can you get below fourth graders responsible?
Great.
I mean, that seems like a challenge in some of these different demographics. We're having a challenge getting maybe more the parents to say, yeah, I care about my child's health care. And they may not care about the child at all. But I mean, is there a way to get them to care about their child's teeth? I mean, have you found a trick on that? Because we're struggling with that with some of our practices.
I think so. It's a big, scary world right now. People are just spending a lot of time in fear. If we can make it even simpler than for the fourth graders. So for little kids, tell, show, do is very important. What I mean by that, if you're having them come to the dental office, and you could translate this into other, podiatry
Right.
and you want to give them a tool they can actually see. So one thing we have that's amazing is called disclosing solution. Basically, it's paint that sticks to the plaque on your teeth. Instead of telling them all of these theory ideas, I say, I'm going to paint your teeth with this and it's going to show us where the germs are living. The clean spots are going to be white, the new plaque is going to be pink, and the old plaque is going to be blue. When germs have an opportunity to sit on your teeth for longer, that's when they cause trouble.
Yeah.
I'll ask them, like, what do germs in your mouth do? Kids usually know. If they don't, I tell them, germs make your teeth and your gums sick. And then that makes the whole rest of you sick too. So you paint this on and then you show them the mirror and you say, what do you see? So again, it's to them. What do you see? A 4-year-old, you give them a toothbrush and you show them how to do it and you brush their teeth with them and you take that time instead of hurrying up and trying to pick and scratch and get them out there. You get right next to them, get that mirror and toothbrush out and you say, what do you think? What do you see? Look, see when I do these soft circles, do you see how quickly it makes those germs go away? We wash our hands before we eat and after we go to the bathroom so we don't get sick. This is the same thing. Those germs that you're washing away at school and at home, they want to do the same thing. These germs, though, they're usually pretty quiet, so you don't know that they're there. That's why we have this paint. You're having that whole conversation with them. I show the parents and I visit with the parents. One of the best ways I've got parents to floss is by teaching kids how to floss and say, have them floss with you instead of, and they're like, well, I don't floss in the back of their head, but I talk to them like they're already flossing. Because for the kids, we do want to talk about brushing and flossing in addition to showing them where it's at. We have the tools to clearly point out what's happening for them. So yeah, great question.
Okay, good. So ask you what the number one idea was. You shared that with us. What would you say the number one problem that you see in an office is? And maybe it's the same thing, but if maybe you can elaborate on it a little differently.
Well, I don't know. I think that there's a lot of complacency and there's a lot of assumption. So you're not supposed to make an ASS out of you and me. That's how we spell assume.
Yeah.
But we do that. We think our patients don't have money for this. Our patients don't care about this. My team doesn't care about this. My doctor doesn't care about my instruments. And we start making these assumptions in every single direction without any real knowledge. The fact of the matter is if I have not worked in a particular hygiene room, I have no idea if the ultrasonic works. I do care as an owner if the ultrasonic works because I want my team to have the best tools available to provide the most exquisite care. We get in this rut or we diagnose our patient's pocketbook. You come in looking all dapper and I think, oh, well, for sure, I'm going to sell him this, that, and the other. Instead of Here's a human in my chair. I'm going to empower him to decide where he's at, and I'm going to explore with him.
This podcast is sponsored by Snake River Payroll, your hassle-free solution to all payroll needs. With fast, reliable service, they take care of your payroll so you can focus on what matters most. Visit srstaff.net today. Snake River Payroll, payroll made simple.
I don't know where he's at, but I want to know, what medications are you taking? What are you doing? What's your color? Like, I'm looking at all of these things for you as a whole human being, not making an assumption. I'm gathering data, not making a judgment. So then at the end of assessment, rather than being complacent, assuming you don't care and planning on you not going home and getting that power toothbrush, I'm open. What's up? How are you, Carl? How are you? What is this? What are we going to do with this? What do you want for your life? Because if you like disease,
oh, you say it like
then
that.
Who am I to tell you no?
Some of our clinics that we work with, maybe more directly, it's a kind of a Medicaid population. I think we're really fortunate because our doctors are really good and we treat them as if they had all the money in the world.
Right.
Okay, so
as we should.
Yeah. And so in addition to that, like, it's not just the care they get, it's like the look of the office looks really nice too. And so I think that makes a big difference. I did want to improve the office to make it look better. I did that for the patients, but really the staff cared the most, right? And I was kind of stupid and I didn't figure that out until after the fact because I would get in there, they're all happy and they just felt happy to be in a beautiful place. And I'm like, that's so obvious. How did I miss it? I don't know. Yeah. But I did. I missed that one.
Well, I think that's beautiful. In that situation, I think this is where we're going to rip the Band-Aid off. This might not be completely politically correct, but here's the deal.
I like this.
Amongst the Medicaid population, the thing that they are lacking the very most, in my opinion, is empowerment. You know, the moment that we feel entitled to something and stop to care, you don't have that forward looking. You don't have that tenacity to want to go out there and get something for yourself. So I agree. I think that's beautiful that you treat them like they have all the money in the world. I think we should. And I think we should treat them like they have the opportunity to care well for themselves in every direction. Healthy mouth, earn the money, do all the things, and help them know they are super valuable. And so with the children in that Medicaid population, we want to figure out ways that we can talk to them and motivate them and inspire them to be in charge of their own health, rather than they're oftentimes learning that they're just going to be taken care of, which is true. And we do want to take care of everyone that we can. But if we can get those little babies to know that they are powerful and they have the opportunity to live whatever life they want in any direction that they want, then not only are we helping them get healthy teeth and gums, but we're also empowering them to grow up and, you know, do you want to be a dentist like me? What do you want to do with your whole life? Because when we see these patients, we're seeing them usually a couple of times a year, if not more, if they have cavities. So dentists, hygienists, and assistants in the pediatric Medicaid population, there's gold available in there. And we have to take the time with them and not look at them like another number. Oh, Johnny and Susie are here. We're going to hurry up, get them in and get them out. No, let's make Johnny and Susie know they're capable.
Yeah, you hit on something and I'm curious, where do you see things? I kind of agree that there's a shift going as well. And I hope it's real. Nobody's going to care about my health as much as myself, right? Nobody's going to care. You do that for yourself, and I know other people do it for themselves, but where do you see things going the next 5 to 10 years? Do you think that more people are going to take their health into their own hands, or do you think they're going to expect to be coddled more? I mean, where do you see things going in the next 5 to 10 years, just generally in dental?
I see it exploding. It's different in my continuing education classes. It's different on my study club. It's different when I attend other study clubs. When I'm having conversations with my patients, with other professionals across the entire nation, the podcasts that are coming out are phenomenal. There is Peter Attia and Andrew Huberman. I mean, there's a whole list of people that are really uncovering the truth of what's going on. And it's that we have more power than we think we do. You commented that the only way to take care of yourself in some pretty rough situations previously in history is natural remedies. And if something catastrophic happened and there wasn't a doctor available, you were just done. Then we've moved to the doctors in charge of everything A to Z. So that's why we have that sick care system that you're talking about, because doctors are not here to treat the well. Doctors are here to treat the sick. We have to figure out how to live well, which speaks to your natural remedies that you spoke before. So there's this whole new body of science emerging about our body's ability to create and keep homeostasis.
I did not know this.
It's fascinating. It's like the latest and greatest topic. People always want me to speak on it.
Yeah.
And everyone's waiting for, where's the magic wand? And I'll be like, the magic wand's underneath your chair. I forgot it's inside of you. The magic wand is inside of you. There's no pill, no magic wand. It's so exciting. And people want to learn about this stuff. The more that we can open that crack in someone's mind that they have the power to be in charge of their own wellness, the more they go out and seek the information. When we went to school, we learned about the circulatory system, all the things. Nowhere in there was the endocannabinoid system, which is a mouthful.
Okay, yeah.
But the endocannabinoid system is actually what is responsible for homeostasis inside of our bodies. And what it does is it recognizes the way our body is operating. And if something is firing too much, it downregulates that firing. And if something is not firing enough, it upregulates it, which is so exciting. It's a mouthful and it's a can of worms. But to give you the punchline to the story, the secret is ancient wisdom. How are you living to be well? Breath, food, information, relationships, sleep, movement, all of the things that we know from ancient Chinese wisdom, ancient India that brought us yoga, even the practices that were in America up to 200 years ago. All of those natural remedies, sunshine.
Common sense stuff, right? But it's not so common anymore.
Right. Yeah. But that's what strengthens and soothes and tones your endocannabinoid system. It's the most beautiful thing. For your viewers, if they're like, humming a what? Endo, E-N-D-O, cannabinoid, C-A-N-N-I-B-I-N-O-I-D. Just Google it and go down that rabbit hole. You will not be sad that you did.
Pretty interesting stuff. Yeah, I'll check it out, but I'll have to go back and watch the video so I know how to spell it.
I'll send you a link.
Yeah.
I'll send you a link.
That was a tough one. So, this is interesting because now I'm debating if we want to go political or not, but we have Trump, we have RFK Jr. That was kind of questionable if he was going to make it in or not because he wants things to be healthy, right?
Right.
And there's a lot of people that are for that, which I think is a good thing that we want to be healthy. There's some people uncertain about the whole thing. West Virginia, I'm reading right now, is trying to potentially ban food dyes. They're not sure they're going to do it or not, but apparently there's maybe 10 or 12 other states, if I heard it right, that are thinking about joining. So there's this movement of let's get our food better.
Right.
How do you think that will affect teeth?
Oh, phenomenally. The standard American diet is full of poison. Let's be honest and call a spade a spade.
Okay.
It's full of spade. And when you eat the food that we have readily available to us, the bacteria, the bad bacteria, and I shouldn't even call them bad because they're doing their job, right? The bacteria are doing a good job. Their job is just not the one we want in our body. Virulent bacteria love the food we're eating, and it produces cavities. It causes an immune response. I mean, when you eat highly refined food, it causes irritation the moment that food touches your tissue. Hot Cheeto, put it in your mouth. It literally disrupts the skin tissue that's in your mouth.
If I only cared about my teeth, what should I eat? What should a person eat that only cares about teeth?
Can you hunt it, fish it, or gather it? Could you eat it 100 years ago?
I don't disagree.
It's simple. And what's great is so much of the food that is hunting, fishing, gathering available. I mean, we have enough of that food to feed the world 7 times over. This is not a resource issue. This is a resourcefulness issue. And people just don't know. They think, oh, I got a Hot Pocket. It's got protein and dairy. So they think it's a great addition. But what do you think the preservatives that are inside that little sandwich are doing inside of your body, right?
Yeah. No, I don't disagree. And I've noticed as I've tried to eat healthier, my teeth feel healthier.
Yes, right, because they're naturally detersive. So when we look at the skulls of ancient peoples that didn't have toothbrushes, the toothbrush has not been around that long at all. And we look at the way their skulls even were shaped by how they breathe. The food and the way that we operate are even changing the way we breathe and how that affects everything. They didn't have decay in those teeth. And why not? It's because they ate food of the land that was great for their body. Now, they obviously had to try a lot harder to stay alive. So there are some modern things that we ought to be quite grateful for, but we also need to take some lessons that we've learned from our ancestors. I think it's a combination of digging deep for what we've already learned and then looking up for what's next.
That's interesting. Okay, I'm going to pivot to dental insurance. I have a client I work with, and her and I kind of debate on where we see things going. She thinks that the medical community is going to bring dental into its mix, and because it's like it's part of the ecosystem of your health. And I'm like, yeah, I don't know that I see it going that way because of the preventative care. And I see as doctors, in my opinion, the cash-based ones are going to push more preventative care. So I feel like dental's kind of more in the cash-based system. Where do you see things going
I'm
as far as
hopeful.
insurance?
I think my opinion is that we as healthcare providers need to get more active in what we're conversing about with our patients as well as insurance companies. So, for example, we have to be diagnosing gum disease and submitting it. Let's say you work with insurance and you aren't cash pay. We've got to be diagnosing and submitting the insurance and then having real dialogue with the insurance about what this looks like. So a piece of information that is going to radically dictate which way this goes is how the development of the AI companies that are integrated with the insurance companies move forward. So currently, the two most popular AI companies that are looking at the x-rays for dental patients, they're doing a great job recognizing incipient decay, and they're constantly training the system. So when a doctor deletes, maybe there's a lot of things that happen on x-rays that aren't necessarily the whole story, which is why you need more than one picture and you need clinical discernment, right?
Okay, yeah.
Okay, so every time a dentist dumps one of those pieces of decay that wasn't decay, it's training the AI system for what to look for. So the AI is getting smarter and smarter and smarter as we go. Now, you transfer that over to the dental hygiene side of the coin, and the AI is not picking up periodontal disease until it's basically, it's run away. The car has run away. We're down the road. We're not ever getting back. So what we need to do as dental hygienists and dentists is submit to the AI companies and insurance companies, circle the x-rays. This is where the PDL is getting wide. So the ligament that holds your tooth into place is the first area on the x-rays that we see when the infection is moving from the gum tissue down into the bone. So we need to be submitting like, hey, there is disease present. This process is occurring right now. We've got to do something right now, because what we know to be true about gum disease is if you lose the bone that holds your tooth in place, you can't ever grow it back. That bone has a thick top layer that protects the inner layer, right? So we want that thick layer to stay strong. Well, on the x-rays, when this thick layer gets reduced density or not as strong, 30 to 50% of that strength for that top layer is gone before we can see it on the x-rays.
Okay.
So what the AI is doing is saying, oh, that bone height is good. And so we might have lost all of the strength, but because the bone is still up there, then they're not ready to do anything about it because it's not low down here. The problem with that is that thick bone layer on top is protecting the new cells that are growing and keeping that bone alive and healthy. So as current practitioners, and I know that's like kind of deep in the science, but we've got to talk about it if we want it, because we're at that, Carl, we're going to go good or we're going to not go so good. So we're like standing on the fence.
What do you mean with AI? Are you talking about AI?
No, I think as a whole profession.
Oh.
I think the insurance companies, AI, and the clinical practitioners have got to band together and have real open conversations about what this actually means in practice, in clinic, as well as what it can look like with AI and the insurance companies. Because if the AI just says, nope, the bone has to be here, it's good.
So I do a lot of AI stuff. And I was thinking of two things. One is I never thought of an x-ray as, you heard the term garbage in, garbage out. Right. So if you take a bad x-ray, the AI can't really do its work because it's like, so it almost needs to do a reject and say, this is a crappy x-ray, you try again.
Yes.
Right. So that gets a better input. Now, as I have kind of messed around with ChatGPT, sometimes I will ask it questions and it'll give me an answer. I'm like, I know that's the wrong answer. And they're like, no, it's the right answer. I'm like, no, you're censoring me. So I challenge it because sometimes it has an agenda or opinion. People say it doesn't. I'm like, yes, it
Just
does.
does.
It absolutely does. Now, I could see a day where as a consumer, I'm like, almost trust the AI more than the dentist. I could see that happening. Maybe
Because
not this year, next year, but maybe in 10 years. As you were talking, I was thinking the AI. So this is kind of what I do when I do financial analysis. Sometimes some numbers don't always correlate. Like I have this and this, and it looks like it correlates, but it really doesn't. So as you're talking about the tooth and the AI based off conventional wisdom says, well, the bone height, whatever, this is what we do. But the AI might, and sometime they're going to realize that there's a better correlation, right? And so now we're searching for better, because we have the technology, we're searching for better correlations that hopefully can make us to make predictive conclusions quicker. Like, oh, I didn't see that, but we don't know for a fact, but all indications are you got a problem here.
Yes.
And we need to deal with today, because if we don't tomorrow, it's going to be way worse and you're going to lose your tooth or something. So that's interesting.
Today is the cheapest, easiest, quickest, most comfortable, most fun time to treat this disease.
True.
Period. Today.
Yeah, that's true.
It will be more in depth. And what's so cool about gum disease is why I get so excited about finding early disease is we can restore. I told you about the ligament that gets mad and the crest of the bone that gets mad. If we catch gum disease when it's there, still showing signs of permanent destruction, we can actually get that periodontal ligament to heal completely and gain all the strength back of the bone. So if we get in there, treat the disease, and then ongoing do the maintenance required to keep the bacteria, they're called red complexes.
Yeah.
Anyway, gram-negative bacteria out, then you go from someone that had gum disease to someone that was totally healthy, and then you don't have to worry about gum disease your whole life because now you're empowered and equipped with the tools that you need to be in charge of your wellness, which, because we caught early, was fully restored. That's big in my book.
Yeah, that is big, because if you lose it, right? At least in today's world.
Right. And think about this. So we can clean 3 millimeters at home with floss, toothbrush, etc. But if you come to me, Carl, and you've got 7 millimeter pockets that I can't see down in, I'm going to clean them well, but I can't see down in there. How do you think the climate is for the bacteria are causing this trouble?
They're having a heyday.
They're a heyday. So here's one more cool thing about the science of all of it. You guys can see, like, I light up about this. Captain Obvious over here. Our heart pumps blood up to our gums, and then it takes whatever it found up there and drags it through the rest of our body. So if your gums are intact, your gums are skin, same as your hands. So if your gums are intact, it just pumps up, fills the capillaries, does its like regen thing, and then goes throughout the rest of the body, no problem. But if the heart pumps the blood up and there's gum disease, because the bacteria die, their body release toxins, it creates a little hole in the gum. So now the bacteria that are alive get to swim in and out, and the dead bacteria also enter the bloodstream. So then the heart pumps the blood up, takes all of that, like sewage, if you will, drags it through the rest of your body, eliciting an immune response from every system. Your liver gets so mad, for example, releases LDLs. What's LDL? Bad cholesterol. Now we're talking heart disease and stuff, right?
Right.
So if we can get a patient to have tissue that's intact, then we're not adding to the heart disease. Every other disease you could possibly have is affected by gum disease.
Interesting.
So let's catch it early, and we can do that with the help of the insurance companies and the AI. But what we have, back to our earlier conversation of complacency and assumption, oh, I don't think they care, oh, they're never going to change, or they're going to deny me. We make all of these assumptions and we're not speaking to the truth. And if we share the truth has a way of shining bright.
Yeah.
And if we can give it as much room to shine as possible, all of these issues get better. Is that ever going to be perfect?
Nope. But it can be better. Right.
But it takes you and me.
I want to pivot and ask you just a couple last questions. So I know you and your husband own a practice. As a practice consultant, I want to ask you a couple questions. One of the things, we were having a round table meeting the other day with a bunch of owners of different clinics. And it was kind of funny because I asked, who's the number one high risk liability in the practice? Who do you think it is? We have an answer for it. I don't mean to put you on the spot.
Like your employees or your patients, like in one direction, who's high risk?
Okay, so when we were talking to them, we said the highest risk person in the practice is the doctor.
Oh.
because they might have a tendency to overshare. They might have a tendency to share personal things. Probably not a good idea. They might give the office manager passwords to banking information or who knows what, and we're like, don't do that. It was kind of funny because one of the doctors was on the call and he was like, not agreeing at first. And then after a few minutes, he was kind of going, damn, I think he's right. I'm a risk,
Wow.
If he starts thinking about the knowledge he has and all the things he knows and has to do. So we're on this quest to help owners protect themselves. So as an owner, what advice would you give the people watching this that they should protect themselves? What are your top 2 or 3?
Yeah, I think that it's really important to build a team that you trust.
Okay.
And so to a certain extent, you do want to be able to share with them the ability to navigate through the business so that they can operate well. And I think that there also always has to be a checks and balances system. So in my practice, I check all the bookwork. I make sure that the insurance checks and the payments from the patients and all of that those all match in all of the categories that you would look at. And so chart auditing, I guess, is the best way to say that. I think it's super important to have your hand in all of it and be present with all of it.
Who pays your bills? Do you guys pay your bills or do you have an office manager pay your bills?
We pay the bills, but a lot of them are automated now.
True,
so
which is nice.
But then you need to still check that bill, right? Because
what about bookkeeping? Do you let the office manager do the bookkeeping or do you keep that a little more tight?
I do the bookkeeping.
Same thing with bank accounts and passwords.
Yep, I do all of that.
Okay.
So you do have to have an active role. I think that you could hire it out, but you would want to make sure that, like you said, you just can't give all the power to one person. There has to be checks and balances is my number one recommendation. I really believe that supporting and loving your team, being a part of their life, treating them as humans, making sure that they see you as human. When you say, don't share too much personal, I agree. You don't want to undo the kimono, but at the same time, there has to be that mutuality of respect. And you're a human, I'm a human. You're trying to take care of your family. I'm trying to take it, so that there's that shared experience. But I just don't think there's any way of getting around making sure that your hands are in the books and that you have someone.
So we have a client, and we started doing his bookkeeping recently, and his office manager was doing the bookkeeping, and it's just kind of out of her skill set. Plus, to be honest with you, it's not a good use of time because she's so much better on the front. We think an office manager should be a people person and not a numbers person. So there's a lot of reasons why. And as we've talked about, like trying to help him curb his expenses, I said, well, I want you to pay the bills for the next 6 months. He's not too excited about that. He's fighting back. And I go, listen, you're going to save a lot of money if you pay the bills because you're just going to see things, if you pay the bills. And I have one last question for you. This is kind of a unique situation, okay? So I'm going to pick on you. I didn't tell you I was going to ask you this. So I've worked with a lot of practices where spouses aren't working in the office because it can cause some serious issues. Okay, it looks like you guys have found success with that. What's your secret to not upsetting the office by both of you being there at the same time?
Right. So it is a tricky dynamic, but it goes hand in hand with showing up as a human. My team knows that I love them. They know that I care about them and their children and what they have going. When they're sad, I cry with them. And when they are happy, I celebrate with them. And it's a little tricky as a practice coach. So for me, I try to be very careful in not making them feel like I know everything. I try to always ask what they think, how they feel, what they would be willing to do. Have you seen this? What do you think about that? Usually my team is willing to step up and lead. The reality is good leaders don't lead well. Good leaders inspire other leaders.
Right.
So that's my hope, is that as I am matriculating through the office, I'm arm in arm with them rather than the boss. And obviously I don't get to do all the arm in arm stuff, but I do enough of it that they know without a doubt that I am with them and for them. And so it doesn't feel weird that the boss's wife is in the office. And then, as a hygienist, I feel very fortunate. I'm able to fill in and help them. So when they are sick and having a hard time, I actually can go and be there and do that. I'm not a fabulous assistant, but I'm a warm body and I can help with the suction. And then I'm completely competent at answering the phone. This smiling while you talk thing's super easy for me. So I can help everyone except for the dentist. If one of our doctors is sick, we are, to your point, because they're the highest risk. Other than that, I clean the toilets and I just try to show up in a place of love and service. And be danged if they don't do the same.
That's great. Well, before we finish, I want you to tell people how to get a hold of you. I want you to show off your book that you've written there.
Yes. Okay.
And tell us a little about your book and how they can get a hold of you.
Perfect. Cool. This is Dentist, Hygienist, and Cows. This is Aggie. She's a Red Angus. For those of you here in Pocatello, Idaho, she is at the Klinger Farms. And the whole idea behind this book was to give dentists and their teams the recipe they need to have fabulous days while taking individualized care of their patient, being able to see a human, do the detective work with them, and inspire them rather than lecture them. My website is brandihookerevans.com, just my name, super simple. And you can find this on Amazon. And I wrote it. It does have some definite dental specific things in it.
Sure.
But my hope is that people of other professions would be able to read it, whether they work financial advisors or practice advisors or nurses or podiatrists, and be able to glean some really easy how-tos that make it easy to take individualized care of every human that walks through your door, because I believe it really is an honor and a blessing and a privilege to be able to care for another human in any capacity.
Yeah, that's great. We will make sure that we link to that.
Dentist, Hygienist, and Cows.
We'll link to that. We'll link to your website and everything. Thank you so much for taking your time.
Oh my goodness. Thanks for having me. It's so great to be here. Thanks, Carl. Thank you. Thanks, everyone.